video. How do I click to the next? Do you want to just?
Yeah, if you'd like to just do that, and then whenever you get to the video, you're going to hit play, and then you're going to stop it right at a minute and 20 seconds.
Sure. بسم الله الرحمن الرحيم إن الحمد لله نحمده ونستعينه ونستغفره ونستهديه ونتوب إليه ونعوذ بالله من شرور أنفسنا ومن سيئات أعمالنا من يهده الله فلا مضل له ومن يضلل فلا هادي له وأشهد أن لا إله إلا الله وحده لا شريك له وأشهد أن محمدا عبده ورسوله صلوات الله وسلامه عليه وعلى آله وصحبه وسلم تسليما كثيرا أما بعد يا أيها الذين آمنوا اتقوا الله حق تقاته ولا تموتن إلا وأنتم مسلمون. We praise and thank Allah Azza wa Jal for His gifts that are priceless and that are innumerable. We praise and thank Him subhanahu wa ta'ala that He has blessed us with guidance and that He has blessed us to be from His worshippers. We praise and thank Allah Azza wa Jal for having blessed us with health, having blessed us with family, having blessed us with safety, having blessed us with providence. We praise and thank Him subhanahu wa ta'ala for having favored us over so many other from His creation that if we were to compare ourselves to the majority of the world, we would see that we're already living in paradise. We praise and thank Him subhanah, knowing that we can still never do Him full justice subhanah, but we ask Him Jalla wa Ala that He accept us and all that we do, and that He forgive us our shortcomings as well as our transgressions. Allahumma ameen. We are so grateful to Allah Azza wa Jal that He has blessed us to make today happen and that He has blessed us to live till today. Today we are focusing on a topic that is taboo for many a Muslim. Unfortunately, where taboo is something that should not really even be on our list. As if we were to understand Allah Tabarak wa Ta'ala and what He teaches us through the Quran, He says, Tabarak wa Ta'ala, Wallahu la yastahyi min al-haqq. That Allah Azza wa Jal is not embarrassed of the truth. That there is nothing shameful about the truth. Life issues and matters of what we as Muslims living in this country are dealing with, these are not things that we can continue to hide from. Nor should we be superstitious and think that by talking about something that perhaps we are going to call attention to it, whereas nobody else knew about it before. Or that we're going to in somehow, some way, shape or form by talking about it, bring it into creation. Our words don't bring anything into creation. Allah Tabarak wa Ta'ala is the one who brings things into creation by His command. Kun fayakun. He commands it and it exists. Our job as believers is to be as mindful of what our surroundings have and are, the good and the bad, so that inshallah ta'ala we can better adhere to what there is of good, as well as protect ourselves from what there is of the bad. So what we are doing today is actually a sunnah. A sunnah. We know that Mu'adh radiallahu anhu would say, كَانَ النَّاسُ يَسْأَلُونَ النَّبِيَّ صَلَّى اللَّهُ عَلَيْهِ وَسَلَّمَ عَنِ الْخَيْرِ. That the Sahaba ridwanullahi alayhim would ask the Messenger sallallahu alayhi wa sallam about goodness. And he said, وَكُنْتُ أَسْأَلُهُ عَنِ الشَّرِّ مَخَافَةً أَنْ أَقَعَ فِيهِ. But I would ask him about what there was of bad and of evil out of fear of falling into it. So ahbab, this topic that we have before us today, it's a heavy one, but it's a necessary one. And so I hope and pray that our gathering, that Allah Jalla wa Ala bless us and that He placed this time for us as an act of worship, that it all counts for us. Allahumma ameen. The format, inshallah ta'ala, will be that I'll go ahead and begin as I have already done. I will then pass it on, inshallah ta'ala, to the next presenter. But to begin with, ahbab, we have a beautiful panel that is here before you. Some of you, if you're new here, I am Imam Shpadim, the resident scholar of IANT. To my left, we have Sister Sahar Zahra, our licensed chemical dependency counselor. We also have, to her left, Yasin bin Halim, who will share with us in the end, inshallah ta'ala, a personal life story of his. And we all know how powerful stories are, and this here is truth. And to his left, we have Adam Ghoshi, who is an interventionist. Inshallah ta'ala, we will break for Maghrib. There will be some food that will be available for us, inshallah, after the salah. And we'll continue, bidnillah ta'ala, with the remainder of the program. And of course, have interaction. Your questions, your concerns are very important. So they will be, inshallah ta'ala, addressed, and there will be plenty of time for it. I want to share this video. And I ask that as you are watching this and as you are listening, pay attention to the broader message that is there. Think beyond location, think beyond people. Don't stereotype. This is a program that was made by Vice. Some of you may have heard of Vice. I think HBO is the owners of them, and they have all sorts of, like these mini documentaries that they've put together. This is one of them.
Opioid epidemic is pretty bad in Dearborn, also all over the state of Michigan.
Opioid-related deaths here in Michigan are soaring. The counties with the highest reported number of deaths are Wayne County.
I was shocked to realize that the opiate epidemic had reached the Muslim community. This is a new crisis.
In the Muslim community, people were trying to treat addiction at home.
My parents were denying that I had a drug problem. It was obvious that I was doing something wrong.
Unfortunately, within our community, the failure of the child is automatically taken as failure of the family.
Drug addiction has destroyed my family. Here, every parent's in denial, like the amount of ODs that's been going on since 2016.
We just got a spike in calls for narcotic overdoses, mainly in the Muslim community. We might have a family tell us it might be a diabetic issue, when 100% it's a drug overdose.
These are the last two I will ever allow to put in my body ever again.
The biggest anger with the issue was people pretending it wasn't an issue at all.
There are many Muslims that never seek help and then ultimately end up dying because of the shame and the guilt.
Inshallah, everybody's gotten their Black Friday shopping out of the way. No? How do I get out of this? Good. So now. So ahbab, when we look at that video, Dearborn could very easily be Dallas. What you may have seen of the Shiite community there is very easily the Muslim community as a whole. And if you have not seen that video on Vice, I encourage you to, because you will relate with it 100%. You will come to see that the details of that video, the documentary, are things that for us as Muslims, the backgrounds we come from, the culture, that we'll be able to identify with those things. And we'll come to see how, subhanallah, although we all believe that Islam is the solution, that Allah Ta'ala through Islam has blessed us and given us guidance for everything. As Allah Ta'ala Himself says, مَا فَرَّطْنَا فِي الْكِتَابِ مِنْ شَيْءٍ. We have not forsaken anything in the book. The Quran has not left anything out. Nothing. But it's our job to understand it correctly. And I'll conclude with this. It was mentioned that sometime during the Bolshevik Revolution, when the Russians in the Turkic-Russian wars that were happening for over a century, they had captured a scholar. And they had wanted to crush not just the scholar that they had, but they had wanted to crush the faith and the morale of the believers. So they had taken the scholar in front of a huge presentation of people, and it was public. And they asked this scholar saying, Imam, is it true that you claim that your book, the Quran, has answers for everything? And he says, yes. He says, what's your proof from the Quran that that's the case? He says, Allah, the Mighty and the Majestic says, مَا فَرَّطْنَا فِي الْكِتَابِ مِنْ شَيْءٍ, that we have not forsaken, we have not neglected, we have not left anything out from the book. He says, then tell me, does your Quran teach you how to bake bread? Hear that correctly. Does the Quran teach how to bake bread? They thought that they got this guy stumped. The Imam said, yes. Yes. They said, really? Where? Show us. He says, Allahu Rabbul Alameen in the Quran says, فَاسْأَلُوا أَهْلَ الذِّكْرِ إِن كُنْتُمْ لَا تَعْلَمُونَ. Ask the specialist about what you don't know. So when it comes to baking bread, Allah tells us in the Quran to ask the bakers, to ask the specialists. Alhamdulillah, ahbab, we have specialists in our ummah locally, in all the different fields that we can think of. It's just our part to, inshallah ta'ala, get to know them and to value and appreciate them in the services they're providing. And alhamdulillah, that's what we are blessed with from among the panel that we have. So here, next inshallah ta'ala, is our sister Sahar Zahra, who is a licensed professional counselor and licensed chemical dependency counselor. She has earned her master's in clinical mental health counseling in 2018. She currently works at Compassionate Psychiatric Services in Frisco, where she serves as the director of counseling services and sees individual patients. She is passionate about working with minority communities, our communities, and bridging the cultural gap for first and second generation immigrants, that which so many of us between our parents and children, that gap that exists. Her approach is founded on the belief that in order to be fully nurtured and content, individuals must address all mental, physical, and spiritual aspects of their professional and personal lives. She advocates for her clients and the community she serves and hopes to break down stigma surrounding mental health care. Without further ado, we welcome our sister Sahar. Allah Ta'ala bless you and her and everyone else. Allahumma ameen.
Sure. Thank you, Imam Shpendim. Assalamu alaikum wa rahmatullahi wa barakatuhu. Thank you, everybody, for joining us today. Can everybody hear me okay? All right. And I want to say thank you to IANT for hosting this event, as well as thank you to my fellow panelists, Yassine and Adam, for coming together to deliver this message that we are all very passionate about and very excited to share with you guys. And thank you all for attending. I know that, as Imam Shpendim said, this can be a very taboo topic, and people can be even afraid to come to an event like this. So thank you guys for coming. And Imam, thank you for the wonderful introduction. So we're going to get started. Imam Shpendim mentioned that I'm a licensed chemical dependency counselor, which just means that I treat individuals who suffer from addiction. So part of the program that I'd like to talk to you guys about is getting a real understanding of what addiction is. So this is the American Psychological Association's definition of addiction. And what it says, in short, is that addiction is when our brains and bodies get used to a drug so much that there are consequences to both using and stopping use, right? It's also important for us to note that addiction is a chronic disease. In the medical community, addiction is most likened to something like diabetes, where we know that there are genetic factors, as if a family member had it, and it's easier for us to have it because they did. And there's also environmental and lifestyle factors that can contribute to us developing that disease. And that it requires lifelong treatment. It is not something that we can treat acutely and it's going to go away. It's something that we have to continue to maintain treatment for. And as we discuss what addiction is, it's very important to note what addiction is not. And I wanted us to be very clear that I know that in our community, addiction is seen as a moral failure or a failure in parenting, a character flaw, a weakness in willpower, a sin or a curse. But it's important to remember that it is a disease. It is not something, as Imam Shpendi said, that's something that we need to be ashamed of and hide from. So I want to talk a little bit about the elements of addiction. How do we recognize what an addiction is when it's in front of us? And how do we differentiate it from what might be considered recreational use, right? Not to say that we are condoning recreational use, but this talk in particular is for us to understand how can we recognize if a loved one, a family member, a friend, or even ourselves are on a path of addiction, okay? So the first element I'm going to talk about is tolerance. Tolerance is whenever we recognize that the substance use is increasing for us to get the same type of effect that we did before. So let's say, I'm just going to pick a name, Khalid uses marijuana, and he used to use maybe one joint to get high, and now he needs 2 to have that same effect. That is tolerance. His body is increasing tolerance against the substance. Cravings or urges are a sign of addiction. If there is a physical desire to continue use. The inability to quit. So if somebody has been using for some time and maybe decide, I want to cut back on my substance use or my alcohol use, whatever their drug is, but they're not able to do it on their own. And they do try. They set boundaries and limitations. Maybe I'm just going to do it in the evenings or the weekends, right? But they're not able to adhere to those boundaries. It keeps reverting back to excessive use. Neglecting family and relationships. Maybe they're not coming over to family dinners anymore. Maybe they're skipping birthday parties for loved ones. That's a sign that the use is really impeding on their ability to maintain those relationships. Withdrawals are probably one of the most recognized symptoms of drug use. So whenever somebody is trying to quit, or maybe just even in between uses, they experience withdrawal symptoms that push them back towards the addiction. So withdrawal symptoms can range anywhere from headaches, tremors, nausea, seizures, and even death. So that's why it's very important whenever somebody is seeking treatment that it is done under medical care. Disturbances to work, school, or personal life. If they're unable to meet their deadlines, if they are unable to maintain friendships. Legal or health issues. If their doctor is telling them that their liver function is going down, or if they've been arrested for stealing or gotten a DUI, that is a big sign that this drug use has become excessive. Using in dangerous situations. If someone is using while they're driving, or in a public place where it's very easy to get caught, that is another sign. Reduced involvement in enjoyable activities. Maybe they used to play tennis every weekend. Maybe they used to be part of a book club, but they are less and less involved in those things that used to bring them joy and make their life fulfilling. Continuing to use despite an increase in depression or anxiety. I think this one's really important because a lot of people who start to use are trying to cover up some other symptoms of either depression, anxiety, or other co-occurring mental health disorders. But despite the use, they are seeing more depression and more anxiety in their lives. Okay. So this is kind of just a quick overview of some of the criteria that professionals look at to decipher if this is something that requires treatment. Okay. What are some of the risk factors to an addiction? Well, it depends on a lot of factors. Obviously, we talked about genetics is a big part of that. If you have a family member who might have used in the history, that's part of it. But also the age of first use. Mental health concerns, like I said, depression, anxiety, bipolar disorder, schizophrenia, all of those increase somebody's likelihood to develop an addiction. Behavioral or impulse control issues, exposure to trauma, violence, or abuse, a lack of healthy coping skills, environmental factors, all of which can lead to an addiction. What does the research say? So there's not a lot of research out there on the Muslim American community and addiction. And that's most likely because a lot of us in the Muslim American community are scared to get treatment. We don't go and participate in surveys about addiction either. We're not self-reporting. So that's why it's difficult to get data. But if we look at other Muslim countries, there is some more data that we can pull from. And I think it's safe to say that if in Muslim countries where alcohol and drugs are under severe prohibition, there is addiction, then it's safe to say that in the Muslim American community where drugs and alcohol are much more accessible and prevalent and normalized, that we would also see problems in our communities here. So some of the research shows that in the Netherlands, Turkish and Moroccan descent heroin addicts were less likely to go into treatment and spent less days overall in treatment than their Dutch counterparts. In Saudi Arabia, they're seeing that 20 years ago, when they had patients in for substance use, the addiction was usually with one drug or alcohol. And now they're seeing much more increased rates of what's called polysubstance abuse, meaning that they're using multiple drugs or they're addicted to multiple drugs. And according to counselors, American Muslim substance abuse patients, especially women, seek treatment where they will not be seen, meaning that they go outside of their communities because they don't want to run into somebody that they might know or a family friend might know. The biggest and I think the most important takeaway that I would like for you all to have from this entire presentation is that the research shows that stigma inflicts greater psychological pain than the mental disorder or the addiction itself, and it is a key barrier to rehabilitation. What does that mean? It means that us individually and as a community, if we continue to stigmatize mental health and addiction in particular, then that reduces the chances for our brothers and sisters who are struggling with addiction to get the help that they need. Okay. Thank you guys for listening, and I'm going to pass it over to Adam Goshi. Adam was born and raised in Garland, Texas. Through his own personal struggles with addiction and alcoholism, Adam developed a passion for helping individuals suffering find freedom from their addiction. Adam finds that the most effective route to achieving long-term sobriety is through intense work with the family in conjunction to addressing the symptoms of the sufferer. Adam is a trained interventionist. He has held numerous positions in the field of substance abuse, ranging from working directly with clients at the facility, facilitating educational groups, working with adolescents in their approach to recovery, managing sober living homes, coordinating admissions, assisting in staging and performing interventions, and one-on-one recovery coaching.
Thank you, Sahar. I'm Adam Ghoshi. Assalamu alaikum, everybody. I'm very grateful to be here. So I'm a certified case management interventionist, and I'm also the director and co-founder of a men's treatment program located at Forest and 75. So let me switch through the slides here. So I wanted to go through the different treatment options. What's available to somebody that might have substance abuse or alcoholism. So the first step would be taking notice. Let's see. So acknowledgement. So the first step in getting your loved one on the track to recovery would be acknowledgement, right? Acknowledging that there's a problem, acknowledging that you notice that something is going on, right? They're missing school, they're going to jail, their friend group might be going to jail and using drugs and alcohol, acknowledging it. So sitting across from them and letting them know, that you're there to help them, right? Because this is, I'm from Garland, Texas, and I grew up in Richardson, and this area seems to be plagued, right? Like there's a lot of alcoholism and drug abuse in this city, and that's not just this city, right? It's just something that we're dealing with. So things to say, right, to your loved one. I see you're going through something. How can I best support you, right? I've been worried about you. Can we talk? If not, who are you comfortable talking to? Another thing that you can do is you can get my phone number and you can call me and we can talk about it in private. Everything that I talk about to my clients and to families is absolutely private, and I do not share it with anybody. This doesn't look right. So I wanted to talk about supporting recovery, so helping them find a treatment option, letting them know that you're there to help as long as they help themselves. So what does that look like, right? So for instance, let's imagine you have a son or a daughter or an uncle or a cousin that was just released from jail for a DWI, right? And they need help paying for their car note, and they're not looking for a job, and they're not interested in getting in recovery, and they've went straight back to drinking. Are we supporting them while they're still using, or are we supporting them in their recovery? So supporting addiction versus supporting recovery. So supporting addiction is ignoring the issue, acting like nothing is happening at all, right? Acting as if there's no problem, acting as if, maybe they'll pull themselves up and get back on their feet at some point, which, as we've seen, with cases that I've dealt with and people in my own family, it seems to be just a vigorous cycle, right, of them getting themselves back together and them ending up back in treatment. Or never seeking help and passing away from a drug overdose, as we saw in the video that Imam Shbendim played. Supporting addiction also looks like working harder than they are to solve the problem. So if my loved one or my friend or whoever it may be is aware of their alcoholism, is aware of their addiction, and they're taking no effort in order to solve their problem, and however, I'm on the phone and I'm calling everybody that I can and I'm talking to everybody that I can to try to get them some help, I'm working harder than they are, right? Enabling them with money and bailing them out. So what that looks like is let's say, I talked about this earlier, but your loved one drops out of school or they're released from jail or they lost their job because of their addiction or alcoholism, and they continue to drink and use drugs and alcohol, and now you're giving them money, right? You're giving them money in ways such as paying their phone bill, right? You're giving them money such as paying their car note. You're giving them a place to stay, and the whole time they continue drinking and using, you're supporting their addiction, right? So supporting recovery. So So what an interventionist does, what my job is as an interventionist is my job is I work with the families. I work with the families to help them motivate their loved one to find treatment, right? Because I'm a professional and I know it's hard to do. Sometimes it's hard to confront your loved one and let them know that there's a problem. It's hard to tell your son or your daughter or whoever it is that you don't want to pay their car note, and it's hard to tell them that they can't live with you anymore. You know, but again, by letting them live with you and by bailing them out, you're supporting their addiction. So, how to take care of yourself when dealing with an addict? With eat, sleep, and exercise. So seek therapy or support, which is what me and Seher do, right? Seher is a therapist. She works with a lot of families, and I work with a lot of families, and you know, I'm aware of a lot of support groups around town that people can attend. Stop financial and emotional enabling. Oh, I think I went too fast. So my treatment program that's off of Forest Lane and 75, you know, if anybody would at any point like to sit down with me and ask me any questions about how we, you know, if you have anybody that you know that might be struggling, I'd love to talk to you one-on-one as well as Seher. We'd love to talk to you one-on-one in private about how we can help that individual. And I will pass the microphone to my friend Yassine. Yassine is 35 years old and he's 14 years sober, and he is a member here, and he has shared a message of hope with countless addicts and alcoholics across North Texas at meetings, treatment centers, and recovery facilities. He is an active member of 12-step groups. Yassine grew up in Richardson and has been attending IANT throughout the years since he was 14. So Yassine's going to share some of his story with you, and I look forward to hearing it as well. So thank you, guys. I have my contact information up here on the table if anybody would like to reach out to me. Yassine, do you want to?
Assalamualaikum. Yeah, wow, this is great. First, I want to say, well, my name is Yassine Ben Halim. By the rahmah of Allah, I haven't found it necessary to take a drink or a drug since December 18th, 2006. This is my first time speaking. I've told my story a lot with other addicts and stuff like that, so this is my first time speaking in a public setting like this. And I just want to say thank you to you guys for being here, because I truthfully don't know if I would ever come to something like this if it didn't affect, like, my motives for getting sober in the first place were purely selfish. So, you know, that you guys are here is awesome, and I really appreciate it. Yeah, because it's, okay. Yeah, so, yeah, and just a little background. I went on Hajj in 2010, and at that time I was 4 years sober, and it became really clear to me that one of the things I wanted to do is help Muslim addicts, you know, and that was something that I didn't know exactly how it would take the form. So when I got this opportunity, I was like, yeah, definitely. Even though it's, you know, it's one of those things, it's an intimidating thing. So I'll give you guys a little bit, I'll start with a little bit of background. I'm going to try to keep it in 13, you know, keep my time short. So I was born in San Antonio, and I was raised in Southern California. I'm half Libyan, half Texan. My mom's Texan, my dad's Libyan. I come from a very, very good family. I mean, I come from the kind of family that neither of my parents have ever drank that I know of, you know what I mean? I grew up in a Muslim household where my father prays Fajr every morning, and it's very loving Islam that I grew up with too. And I have two siblings. My sister's a law professor. My brother's a, like, I mean, and it's turned out okay for me too. But what I'm saying is my family context is one that I can't point to, oh, it was something in the family that, you know what I mean? Or something that, now I had a lot of medical stuff when I was a kid. I had epilepsy. I got very sick multiple times. My mom was in the hospital a lot when I was a kid. There was a lot of intense emotional pain in my childhood. And also, too, just the society I grew up in. I was one of those kids that always felt very different. And it didn't help being, like, I can remember the distinct moment that I went from just being another minority to being like, oh, one of those people, like after 9/11. Because I was 13 when 9/11 happened. And that was a big moment where I was already kind of an outcast kid. I was already like kind of nerdy, but the nerds didn't want to hang out with me. Kind of, didn't play any sports. And then I went from being just like the Asians or like the other kids to being like, oh, you're a terrorist, whatever. So there's like a lot of, I say all that to say that there was a lot going on in my life prior to my first use, and there was a lot of emotional pain and social ostracization and a lot of anxiety. And, so anyhow, I had my first drink or drug when I was 14, 15, and I thought, oh, this isn't, it's really funny the way it happened actually, is that I was at a party and I had been smoking cigars, because I smoked shisha, I was 15, and my throat was super parched, and there was nothing but Keystone Light in the cooler. And I was like, I'm so parched, I have to have a drink. And that's how I had my first drink, which is maybe not funny to you guys, but it's funny because there's this idea of the insanity of the first drink, that like we start drinking for the most trivial reasons. Anyhow, yeah, so hold on, where am I going to get to? Visma, okay. So from there, my use really ramped up quickly. That same year, I was drinking and smoking weed, nothing really heavy yet. And I got in a car accident where I was in the backseat of an Xterra, and it rolled like 9 times. And then alhamdulillah, I had no physical illness. Like my first thought once the car landed was like, I gotta get out of here, because like my dad's gonna kill me. Like I was way more afraid of like dishonoring my family or like disappointing my father than I was of physical harm, the police, any other consequences. And so I think that's the thing from my experience, was that like it started out as something fun. It started out as something that was I felt relief from, that it kind of like was blindsided me. I'm trying to think of an appropriate analogy of something like that, like your life before and after. But my disease progressed pretty rapidly. Whereas, like, I got kicked out of my first. I went to J.J. Pierce, and then I got kicked out of Pierce. I went to Evolution Charter Academy. I got kicked out of there, and then I went to Winfrey Charter Academy. And it really struck me the interventionist thing, because back behind all that, if you'd asked me at 16, 17, oh, like, what's the problem? I'd be like, it's school. School's terrible. Like, I really apologize if I do swear. I'm going to try not to. But I was, back at that time, it was like, it's terrible. But really what it was is that my addiction was getting worse and worse. And the only reason that I'm a high school graduate is because my mother was kind of sweeping up behind me, being like, okay, got kicked out of this school, okay, where else could he go, okay, and then saying, okay, you're going to go to school here. Same thing, I went to UTD. I have a degree in arts and technology, and same kind of thing there, whereas like my mom was just like in the background being like, okay, here's the application, you do that. And like, alhamdulillah, I mean, I don't know where I'd be without that, but also like at the same time, there was this big thing, which was my growing addiction. Fast forward all that, I went to UTD in my freshman year. I had sensed that alcohol and drugs were a problem, and I had cooled out for about 6 months. And then I got to my freshman dorm, and my roommate said, hey, you smoke? And I was like, heck yeah, I do. And then I was off to the races again. There was no thought about, oh, I just did 2.5 years worth of high school work in 3 months because I wasn't using anything. None of that was there. It was just, there was no thought at all, which led to another 2.5 years of persistent use. I eventually got into methamphetamine, and that was what really drove me to my bottom. And then December 18th, things just got really bad really fast over those 2 years. And that whole time, my parents, I had 2 interventions. Both times I was like, nothing's wrong, like leave me alone, or just like, you know, they're like, we're gonna have a house cleaning day, so come over and help us clean the house. And then it turns out it's an intervention. And then I just emotionally blow up about them lying to me about the reason for them getting me over there. So all that was a lot of, you know, I can't say that at any time in that period I was making much conscious decisions, and that there was anything, my conception of God at that time was that I was like beyond, like I was not an atheist, I was not an agnostic, I just believed, my psychosis was so deep, at certain points I was like, oh yeah, I'm already in hell. Like I died in that car wreck, and I'm in hell. I mean, when I did things, I wouldn't even, when I get pulled over by the police, I wouldn't even make a dua, because I'm like, I know I'm doing wrong, I know I'm wrong, I have no right to ask for forgiveness, because I'm not going to change anything. And that's where I was at 17, 18 years old. The shame was so deep that it was like, it was impossible for me to see any other perspective. And that's coming from a family that, you know, like, I was taught unconditional love and the rahmah of Allah and the mercy. That's where I got to. But on December 18, 2006, I was just at a low point where I couldn't use enough to not feel suicidal, basically. Like, so up to that point it had worked that I could get away from it enough, my feelings enough to be okay for a little while. And then I found myself in a spot where I couldn't use enough to feel okay. And I'd been going on like that for 6 months. And I just had this moment where I was like, something has to change. And it was like 5 a.m. And I had snuck back into my parents' house, showed up for the first time in 2 weeks. And I just decided to flush what I had and make wudu. And it was like, this was the first time, because I was never the type of person like, throw it away, I'm done for good. I was like, nah, Jack, like, you know, I'm keeping my drugs. So I flushed them down the toilet, and then I made wudu, and it was like, light was pouring over my hands where I was making wudu. And then I went and prayed Fajr, and I'm still incredibly intoxicated, and I'm like stumbling through the words, and I feel like this profound sense of foolishness, because it was like, I was like, SubhanAllah, I haven't prayed in so long, and this experience is coming to me. It's like Allah is like, you know, I take one step towards Allah, and He comes rushing towards me. And then those hadith came back to me, and for me that was this burning bush awakening moment, where then I was willing to seek treatment. And so I went to sleep that night, and then I woke up and told my parents, and then I went to treatment. And then from there, I did an outpatient treatment for 2 months, and I got involved in 12-step recovery. And in the 12 steps, I found I'll share one example with you that's actually about the importance for me of, at the same time I also started going to Jummah prayer, and come pray Fajr at the mosque, and then listen to Imam Yusuf's fiqh durs. I was really hardcore. Like for me, like it was a full 180, right? From drinking and using every day to being like, okay, I'm going to be at the mosque praying Fajr. And it was a wonderful time. And at the same time, I started going to meetings, and I was at Friday prayer at Jummah, and I ran into an old buddy from high school, and I was pretty lonely because I had dumped everyone I knew, and he was like, yeah, let's hang out. And so I was like, great. And so I go to their cars right over here, and they all like bust out a joint and start smoking. And I was like, oh, I gotta go. And they're good kids, like there's nothing wrong with them. Like, you know what I mean? They're high school students, they're college students at this point, whatever. They just my perspective is they lead a different lifestyle than me. But I went directly to a meeting from there. And so for me, having a fellowship where it's like-minded people in recovery that also are coming at this thing from a spiritual perspective has been super transformative me, in addition to my participating in my Islam and participating as a Muslim. And I'm not saying I really appreciated what the Imam said about specialists. Because what I found is that, like, for me, 12-step recovery groups, there is a commonality, a common purpose, and a common understanding, so that if I'm having a rough day or a day where I feel some type of way, there's, like, even right now, I'll just be completely honest with you, I can speak more freely in a room full of alcoholics and addicts than I could with the general public, just in the way that when we talk about Islam with each other versus with maybe an evangelical Christian who's got these weird ideas about it, you know, you choose your words more carefully. So that kind of thing. So, alhamdulillah, over the last, I've gone back to school, I've finished school, I've done numerous things, and my life has just blossomed in this way that I couldn't predict. And for me, it's been through, I carry meetings to treatment centers, I carry meetings to halfway houses, things like that. And today it's like my life is really incredible. My relationship with my parents and everything has become mended, and there's a level of trust that I didn't think was possible after what we had been through. And I will say the biggest thing for me with my family was that they were willing. My dad hadn't, the day I told my dad that I needed help, he hadn't smoked a cigarette in 30 years, and he said he hadn't wanted a cigarette more than that day when I told him that the full extent of it, of what I was on, how bad I had gotten. And that's what I want to share with you guys, is that, like, that acceptance from my family and the lack of shame around it, and saying, okay, this is a thing that, like, you're not bad or wrong, even after all the ways that I had been wrong, right? Like the outside things, like leaving aside the addiction, the stealing, the lying, the manipulation, all that stuff. I was wrong in that, but the forgiveness and the willingness to help me that my family provided me with was the foundation through which I was able to go out into the world and seek recovery. And yeah, so it's an incredible thing, and I'm really appreciative to be with you guys here, and I appreciate you all being here. Thanks.
So we'd like to offer you guys some resources that you can reach out to. If you guys wanted to take a picture of this slide, these are some websites that can provide some more information. CompassionatePsychiatry.org is the website to my practice. MAPSnetwork.org is the Muslim Association of Psychological Services, which was actually founded here in Dallas. There's a lot of Muslim counselors that you can gain access through that website. Archway Recovery Homes is Adam's sober living facility, and then IANT Social Services can lead you guys to more resources as well. And then we also wanted to offer our contact information for anybody who might want to get in touch with us. It has all of our emails on there. And like Adam said, if anybody wanted to sit down and talk to us one-on-one, whether it's for yourself, for a loved one, for a friend, whatever it might be, we'd love to offer our services to you guys. All right. Inshallah, I'm going to hand it over to Imam Shpendim now. Thank you.
So we have about 9 minutes before the adhan is called, inshallah. And in this time, we'll certainly open up the floor for any questions that you have. And if you want to specifically state who you want to address the question to, inshallah, of the panelists, feel free to do so. And just so you know, we're not limited to 9 minutes, inshallah. After Maghrib, we're going to come back. We'll have plenty of time. There'll be some pizza at the same time, inshallah. You can help yourselves, relax, and inshallah ta'ala, we can continue this conversation. So, who do we have, inshallah ta'ala, that has a question that they would like to ask, inshallah? Okay. Go, brother.
Bismillah, alhamdulillah, wa salatu wa salam ala rasulillah. Let me start by saying thank you very much for coming to our community, to our masjid, and give us the presentation that you did. For those that they have been addicted, alhamdulillah, Rabbil Alameen, welcome home, welcome to reality. Having said that, I would like to digest my question into several segments, and I would like to have each one of you respond back to from his or her experience on that one. For those that being involved and being addicted, how did you hide, or actually before that, how did you start? How did the whole thing start? And how did you hide these things from your family? Secondly is, for those parents or the family.
Can you take it one at a time so they don't forget and then have you repeat them if it's okay?
Yeah, sure.
Please.
Sure.
So go ahead, inshallah. That first question.
Yes, Adam Goshi. So I am in recovery too. I've been sober since January 5th, 2016, and that's how I started working in this field, was because of my experience. You know, how I hit it, you know, my grandfather and my grandmother are from Palestine, and so is my father, and, you know, I don't think I had to hide it. They never said anything, you know. They never said anything to me. They never asked me about, you know, why do you smell like this? Why do you look like this? Why, you know, how did you lose your job? It was just, they kind of just let me go down the path. I think maybe they didn't know what marijuana smelled like.
Actually, that was one of the questions I was going to ask, which is related to this one. For those families, I'm a Palestinian myself too. I never smoked marijuana until I came to this country. Mm-hmm. All right? And for those that they never grew up in this kind of environment, how would the parents differentiate between a normal cigarette or marijuana for that matter? So for those ones is, from your experience, what the parents should look into, or what's the flag should be, wait a second, my son doesn't smell right, or what have you. So for those parents, what would you tell?
I would say red eyes, sleeping a lot. Marijuana kind of smells like a skunk. Do you know what a skunk smells like?
Yes.
It smells like a skunk. You know, and besides, what does the drug look like, or what do they look high? What does their life look like, right? Are they going to work on time? Are their grades, you know, are they failing in school? All these different things. And then also drug testing, right? So you can get a drug test and drug test your kid. They're very cheap. I think drug tests for 12 panels, which you could test for 12 different drugs, are about $3 a piece.
Okay, I'll conclude with this one, and I don't want to show other people they have. And I think probably this one more into the sister. From your experience, and the same also for you as well, the men, how much did you feel at the time, or how much do you feel right now, that the community as a community, whether it's the masjid as a center or other community centers, they are related in their programs, in their khutbahs, in their activities, would engage in such activity? And the same thing for the schools. Do they invite you to talk to the kids, at what age and what have you? So that way I'm not interested in somebody tell me that you have a cancer. I'm interested in somebody tell me, don't do this one so we will not get to the cancer. Jazakumullah khairan, thank you.
So just so I'm clear about what the question is, you're wondering what the masjids are providing and what we can do for our community.
Exactly.
And what the community can do to engage and get a better understanding of what to do if there is addiction, right? So inshallah, this is the first step for us, actually. This is the first community-facing presentation that we have done because we recognize that there is a need and there is a gap in the community in addressing addiction. Like we said, there's a lot of stigma, there's a lot of taboo. People are worried about even attending a program like this because if they seem interested, then does that mean that I'm an addict or I have a family member that's an addict? So inshallah, what you guys are doing by just showing up and listening and engaging, that's, I think, a huge step, and asking questions and wondering what more can we do. I think that's a huge part of what we want to achieve today. As far as taking it another step further, it's the acknowledgement piece, right? Go home and talk to your family members about it. When you see somebody who might be struggling, approaching them without stigma, without shame, opening up and saying, hey, is something going on? I'm here to listen, right? We don't have to always try to fix the problem for somebody, but just letting them know that there's somebody that they can talk to. Maybe pointing them towards some of the resources that we provided today, right? If we want to see a shift happen in the community as a whole, it's not going to happen overnight, and it's not going to happen with one person. But taking these very small steps that are going to build a new foundation for how we talk about addiction, how we look at it. I hope I answered your question. Okay.
This is a question for the Imam. Maybe you can answer this one. I know, Jazakumullah khair, thank you for providing. But one of the things that is mentioned that I still don't understand is how is alcoholic addiction or drinking alcohol is not a sin? Because from what I know, drinking alcohol is from the big sins, right? So how is that mentioned as not a sinful act?
So I think what's being understood here is different from what's being mentioned on there. When we're looking at the aspect of this being a disease, and we're looking at the person who is struggling with these addictions as being a person who is sick, it's very different that we're looking at this person as being this horrible sinner who is just, whatever it is that they're doing of drinking or drugs or otherwise. There's no question that it's a big sin. What we're talking about is how are we going to most effectively address the person who is struggling with an addiction? Are we going to tell the person, looking at them, that you are some horrible sinner, astaghfirullah, that you are drinking alcohol, you are using drugs, you're going to go to hell and Allah hates you? Or are we going to look at the person from a perspective that they are ill and they need help? The same way that when we look at medicine as a whole, when I go to the doctor doesn't look at me and say, hey stupid, why did you get sick for? Why aren't you taking your vaccine? Why didn't you XYZ? Even though maybe I'm 100% guilty. But imagine, every one of us, imagine you go to the doctor and that's how they speak to you. What would you do? I know I'd walk right out, even if I was 100% guilty. But if the doctor, and they do because they're professionals, they sit and they listen to you, they look at you as somebody that needs help, and they address you from that perspective, then it makes the interaction one that's going to be goal-oriented, and that goal is to help you to overcome the addiction because you can. You can. But in no way are we saying that it's not haram. We're not talking about the ahkam.
Assalamu alaikum. I have a question. Nowadays, you see a lot of hookah bars out there. And our young generations they think it's a passion to be
Lower
there.
your mask so we can hear you better, please.
Yeah. Young generations, they are thinking that it's a passion to go to hookah bar and smoke some hookah with then they think it's a halal and there is no sin. So I just want you to talk about some, how can those young generation can stop going to hookah bars.
Maybe even in the aspect of, is it a gateway, whether it be cigarettes or tobacco?
I want to clarify something real quick along these lines. Is that what I'm interested in, what I'm speaking about and what we're talking about?
الله أكبر الله أكبر الله أكبر الله أكبر أشهد أن لا إله إلا الله أشهد أن لا إله إلا الله أشهد أن محمدا رسول الله أشهد أن محمدا